And joining us now, Dr. Michael Nadorff. He is a professor at the Mississippi State University Department of Psychology, deals with sleep, suicide, and aging primarily. Good morning, Dr. Nadorff.
Good morning. Thank you for having me.
Yes, sir. Thank you. So we have you on because it turns out that September is Suicide Prevention and Awareness Month. And just read some from your background that you've been heavily involved in that subject matter for quite some time in your professional career. And so this is the month where we talk about that. And, it seems like attitudes have changed, have they not, Dr. Nadorff, that there was a time when you just didn't discuss suicide. But now we want to get it out in the open. We want to talk about it. Tell us a little bit about your work with respect to that.
Absolutely. So I think there has been a great change in awareness about suicide in recent years and how much we talk about it, which is fantastic. Because for so long, we really haven't talked about it. And I think because of that, people often don't realize how prevalent it is. So it's the 10th leading cause of death. And to give you an idea, actually more Americans die by suicide than die in auto accidents, which
Wow.
surprises a lot of people. You'd think there'd be much more because you hear a lot more about the auto accidents than the suicides. And it's getting better because people are more able to be open and to talk about it. But there's still a lot of stigma that holds a lot of people back. But I agree with you. I've seen tremendous strides in awareness, but the struggle that we've had is suicide rates have gone up the last 13 years, every year consecutively. You know, we can't say that about any other leading cause of death. And so, even though there's so much we've learned over the years, it's not getting better. And it's still really been a struggle in how we can best reach out and help those who are having those thoughts and who are struggling.
Yeah, so why do you think that is, Dr. Nadorff, that the rates have increased over the last, I think you said 13 years? What do you attribute that to?
I think there's a lot more people dealing with a lot of challenges. If you look at college counseling centers, for instance, um, 20 years ago at a college counseling center, you primarily saw college students that were just homesick. Now you see all the serious mental health. There's a lot of people dealing with a lot of serious mental health challenges. I think it's because our world has only gotten more stressful. You think of, even though technology's brought a lot of benefits to us, having this cell phone next to me means that I'm always on call, and people expect if they send me a text that I'm going to respond. You don't have that natural break and respite that we used to have. And I think not having that break and just having it where it feels like the expectations and demands are only increasing really wears on a lot of people.
Yeah, so I got to ask you, do you think that it's so easy for all of us, I guess, to have some exposure to the lives of others? And just speculating here that perhaps
Mhm.
that stresses people out, makes them feel like that they're inferior or inadequate or not at the same level, don't enjoy the same lifestyle. Is that a contributor as well?
I believe so. And it feeds in with social media. People will ask me, does social media play a role? And I think it does,
Hmm.
because you're comparing yourself to others. And the thing that people often will forget when they're doing that is that people will usually, most people will post the good things and not the bad things.
Yeah,
I'll
exactly.
post, here's my huge 6-year-old. I won't post about the tantrum or those
Yeah,
sorts of things.
yeah.
So, there are some people that always post the bad things, but for most of us, we post the good things. So if you look and you're like, other people don't have these problems. Well, yes, they do. They just don't put them on Facebook.
Yeah. Yeah, exactly. And that was the thought there is that it just seems like that other than the more voyeuristic aspect of social media, I guess that, yeah, everybody wants to convey the positive aspects because they want people to respond positively to that and perhaps praise or laud them. It makes people feel good. And I could see a situation where when you see that happening in your circle of friends, and maybe it's not happening to you, that I guess that just sort of short circuits the mind in that respect. And so you're so right that there are positive aspects, but maybe the negative aspects are everybody else's life is just in living color in front of us all the time, and I can see how that. And of course, we got parents pushing a lot too, do we not, Dr. Nadorff, to achieve or excel or equal the peers of their children? Is that something else that's going on as well in society?
I believe so, and I think that affects both the parents and the kids a lot. If
Yeah,
as your kids get older, it's just an endless stream of activities and events, and
yeah,
I think there is a lot of pushing and pressure. And I think too, one thing that's a good thing to also bring up is while certainly it's become more voyeuristic and we're watching each other more, there's also a
yeah,
potential benefit there. And one of the great challenges we have in this state is the dearth of mental health providers. We have a third of the national average of psychologists. There are 11 psychologists for every 100,000 people in Mississippi. And so with that, you know, people like me, we won't be able to see everyone who's struggling. We won't, as far as identifying, we
yeah,
can see them in therapy. We have resources for that. But one of the things that I think is a real important take home is we need help with identifying those who are struggling in order to refer them to treatment. And that's especially true right now because with all the social distancing, it's
yeah.
harder and harder for people to get identified and referred for treatment.
So before we go here, we got a couple of minutes. What are the warning signs? What should we, as just average, everyday people, be looking for?
So some of the common ones are giving away prized items, obviously being very down and depressed, talking about suicide, just changes in personality where they're just not acting like themselves. When you get really close to a suicide attempt, you can see a lot of insomnia, a lot of agitation. People are very much on edge. And one thing that surprises people sometimes is like if you have a friend that has been struggling with depression for a long time, you can sometimes see a shift to a much better mood.
Yeah.
And people would be like, well, why would that be a risk factor? Well, it's maybe that they decided that they're going to do this and they feel better
Mm.
because they feel like that's going
Mm.
to solve their problem.
Yeah.
So if you see a big shift in people, either positive or negative, it may be worth asking why that is.
Yeah. And you just hear so often. I watched the video of Dak Prescott, who I guess
Yeah,
it's been revealed his brother died
yeah,
via suicide. And it's not only heartbreaking, it's eye opening to watch he and his other brother discuss that and also dealing with their mother at the time. And just incredible and so surprised and shocked. And I think that's the way most of us are. It's just hard for us to understand, what we should be looking for. But your advice is certainly well taken. How does Mississippi rate versus the other states with respect to suicide rate?
we're right in the middle. We bounce up and down a little bit, but we're right around the national average, usually a teeny bit over. Um, So it's thankfully not one of those things where we're at the bottom of the list,
Yeah.
but certainly there's, you know, we do see the growth that everyone else has been seeing, so our rates have been going up, and especially both at the very north and the very south sides of the state, that's where we've really seen the greatest increases.
Yeah, so it's we are obviously known as the overall poorest state, so you can't really say that it's a function of that. I mean, you can't just draw that conclusion as a direct corollary that poverty equals suicide, right?
Sure, and I think people often worry, think too much about this psychological or the disordered side. Honestly, when you think about suicide, think about stressors and think about trouble with dealing with those stressors.
Yeah. Yeah, absolutely. Dr. Nadorff, thanks so much for joining us today, and thanks for your important work there at Mississippi State. And we just hope everybody stays safe and watches out for the warning signs and speaks up, and let's pray for everybody in that respect. Thank you, sir.
Absolutely. Thank you.
Dr. Michael Nadorff from Mississippi State University talking about suicide prevention and awareness. September is the month for that.